How to use an Aneroid blood pressure monitor. Have you ever wondered how to accurately measure your blood pressure using an Aneroid blood pressure monitor? This manual device is essential for managing hypertension effectively. Let's break down the steps to ensure you get reliable readings every time. First, prepare yourself and your environment. Avoid smoking, caffeine, or exercise for at least 30 minutes before taking your measurement. Make sure to empty your bladder and rest quietly for 5 minutes. Sit comfortably in a chair with your back supported and feet flat on the floor. Remember not to cross your legs, as this can affect the reading. Also, remove any clothing that covers the arm you will be measuring. Next, it is time to position the cuff correctly. Place the cuff on your upper arm, about 1 inch above the bend of your elbow. The cuff should be snug but not too tight. You should be able to fit 1 or 2 fingers underneath it. Align the middle of the cuff's bladder with the brachial artery, which is located on the inside of your arm. Support your arm on a flat surface at heart level to avoid inaccurate readings. Now, locate the brachial artery and place the stethoscope. Use your fingers to find the pulse of the brachial artery just above the elbow crease. Place the chest piece of the stethoscope lightly over this artery, ensuring you do not touch the cuff or tubing. The next step is to inflate the cuff. Close the valve on the inflation bulb and squeeze the bulb to inflate the cuff. Inflate it to about 20 to 30 millimeters of mercury above the point where the pulse disappears or above your expected systolic pressure, which is usually around 160 to 180 millimeters of mercury. Once the cuff is inflated, slowly open the valve to deflate it at a rate of about 2 to 3 millimeters of mercury per second. Listen carefully through the stethoscope for the Korotkoff sounds. The first rhythmic tapping sounds indicate your systolic pressure, which is the pressure when your heart beats. The point at which the sounds disappear indicates your diastolic pressure, which is the pressure when your heart rests between beats. After you have your readings, record the systolic and diastolic pressures as indicated on the gauge. For better accuracy, take 2 readings 1 minute apart and average them. For effective hypertension management, measure your blood pressure at the same times each day, preferably in the morning and evening. Keeping a log of your readings will help you share this information with your healthcare provider for treatment decisions. Remember to use the correct cuff size, as an improper size can lead to inaccurate readings. Avoid talking or moving during the measurement. Consistent technique and timing are essential for tracking blood pressure trends accurately. Home monitoring with Aneroid devices can complement clinic measurements and help identify white coat hypertension or masked hypertension. If you are unsure about the technique, consult a healthcare professional for training and calibration of your device to ensure accuracy. Using an Aneroid blood pressure monitor correctly supports effective hypertension management by providing reliable data to guide your treatment and lifestyle adjustments.